Okay, Ritika.
Ma'am, it has started.
Okay, so go ahead, Shrenik bhai.
Yeah. Good evening, friends. First of all, we beg apology for, I mean, being delayed by 15 minutes. As our esteemed guest and speaker, Dr. Vijay was busy in the operation theater, and but the best part is he's back, and he's oncologist, surgical oncologist, particularly with the bone cancer. And the best part is serving the community at India's second best and biggest cancer research institute here in Ahmedabad, and serving the Indian community for years and years together. So, Dr. Abhijit, sir, thank you so very much, and we welcome you on board. Kindly share your
Yes,
experience and everything
yes, sir.
about
I'm
oncology.
sharing my presentation. Yeah.
Yes,
So my screen is visible, sir.
Yes,
Yeah.
very well.
So our presentation is visible, sir, madam.
yes, it is
Yeah.
visible.
Thank you, madam. So good evening, respected chairpersons and dear friends and colleagues. So greetings from GCRI, Gujarat Cancer Research Institute, Ahmedabad. It's one of the biggest cancer hospital across the globe, and the topic of presentation is orthopedic oncology. What was past, present, and future. The work has been performed at GCRI. There are no conflict of interest and there are no financial disclosures. So this is a center where I work. It's a 50 years plus year old institute
Hmm.
situated in Ahmedabad in the BJ Medical College campus, and it's an exclusive cancer center. So what are the reconstruction options? So when you remove the tumor, you have multiple options. Either you can do limb salvage, means save the limb of the patient. You can do amputation, means cut the limb, or you can do modified amputation. So these are multiple options like Indian team, past, present, and future. You have multiple opening options and other options. So similarly, we have multiple options in surgery also. So this is the progress what we have done. So we go directly to bone tumors. So bone tumors is bit rare subspecialty. It's less than 1% of all cancers, and the incidence is quite lower across the globe. So most commonly involves the lower extremity, followed by upper extremity, and shoulder and upper limbs are bit uncommon tumors, we can say. So these are the options. So we have evolved from the silent era of movies to the modern era. So we have all these three options. So we go to a case scenario where you have a tumor involving the shoulder muscle, shoulder bone. So the scapula bone is behind, humerus is in front, and is clavicle. So if we resect the scapula bone from back part, the shoulder blade bone, we have multiple reconstruction options. One is we don't put anything. The disadvantage will be patient will not have any shoulder movement. The shoulder movement will be gone. We can use a proline mesh, that is artificial mesh that can be used. We can use autograft or allograft. Autograft means we can radiate the bone or we can put it into liquid nitrogen, place it back again, make multiple holes. And the recent technology what we are using at our center is 3D printed implant. The meaning is you get the CT scan of the patient done, you mirror one side is shoulder bone and opposite side it will be mimicked, and then you print the plastic model and then you do final metal implant, so that will be made up of titanium material. So we got the patent of these designs for scapula implant. So the advantage is patient will have an abduction movement, so that will be around 40 to 50-degree abduction. Elbow and hand function will be preserved, abduction will be preserved in these cases, so that is the advantage. So this is the use of polypropylene mesh or proline mesh for shoulder girdle tumors. This is putting no implants. This is 3D printed scapula, what we are discussing. That is one good option. Second, we can radiate the bone and put back again. So this is one of our patients where the scar is healed and we have printed a 3D printed, means it's a patient specific. Like preparing a suit for yourself, you go to the tailor and you stitch according to your size. So it is
Hmm.
customized 3D printed implant. So this is one of a case scenario where you give chemotherapy and the patient responded very well, and we did surgery. So this is the few surgical videos will be there in this presentation. So we remove the biopsy scar, remove the tumor with good margins, and this was the functional outcome of this lady. So abduction is possible in this case. There are always complications when you do surgery. It's bound to have some complications, and here the proline mesh was exposed. So what is the future, or what in future what we are thinking, or what we are doing? So robotics, 3D printing, augmented reality, virtual reality, and mixed reality. So this is one of the case scenario where this is scapular tumor. We mirror it. This is a tumor. This is normal scapula. So you mirror from year to year. Then you design the implant. So we designed the implant virtually. So in this case, it was virtual designing of the implant first. Then we print the implant on a plastic model. So that was printed. So this is the implant. We can appreciate here multiple holes are here so that it can be fixed to the chest wall. So all surgical steps can be planned very well virtually. So that is the advantage of the technology what we are using at present. We can appreciate multiple holes so that it can be fixed to chest wall. And this here we will attach the humerus bone. In this case, augmented reality was used. Augmented reality means using HoloLens. So in this case, it's a HoloLens. We can superimpose the scapula over the scapula. So it's like watching an Iron Man movie. The surgeon is wearing the glasses, and if I am wearing glasses and madam is wearing the glasses in Delhi, she can be a part of the surgical team. She can guide or do all the things or support us. So to tell the steps. So some surgery is occurring in New York, and we want to guide that surgeon. So that also can be done with this technology. So it's like watching an Iron Man movie. He's controlling his all gadgets with his Jarvis software. So we can see here the surgeon. I am wearing the glasses and I am touching the images. So it's totally in air. It's total sterile environment. I am wearing the gloves and I am superimposing the chest wall over the chest wall. So in this way, we can have a Google map of surgery so that the artery, vein, and nerves are superimposed. We can appreciate here the chest wall is there. We are superimposing it over the original patient's chest wall. This is a scapula implant. We can zoom in, zoom out, we can superimpose it. The final implant will be placed here. So we can see here the implant design what previously was shown. So this is the shoulder blade, this is the scapula bone. We are placing it and we lock it at that site. So this is the final implant which is placed, and we can superimpose the final implant over the implant. So advantage, below the skin you have muscles, artery, vein, and now that can be superimposed, and very good technology for the surgeon, which is a futuristic technology what we can see here. So this is the implant scapula and we are superimposing it. Next we go to growing joint, means if the tumor is involving in a kid, he has to grow. So kids of 9, 10, 11 years, this surgery is performed. So tumor involving the femur or thigh bone, we remove this tumor and we put this growing joint.
Hello everyone, we welcome you at A to Z of bone tumors.
So this is skeletally immature child, we remove the tumor. And this expandable or growing joint will be placed for this patient. So it is having two types of mechanism. One is a non-invasive and second is minimally invasive. The technology what we are using is minimally invasive. It is an indigenous technology. The magnetic coil technology is too costly for our patients. Cost can go up to 15-20 lakhs minimum. Indian indigenous implant may cost less than 5 to 6 lakhs.
Less.
All the funding is supported by government or multiple NGOs are there who supports for this patient at our center. So this is distal femur tumor in a kid. We will resect the tumor. So there will be a big defect here. Whole knee joint is removed and a growing joint will be placed. So this is the growing joint that will be placed. So this is the patient with growing joint and we will have a screwdriver mechanism. Here small incision is given. So we can appreciate here we are turning few threads and this part grows. So every time you have to give a small incision of 1 centimeter, put the screwdriver, turn few threads, and the limb will grow in his own limb. So every time, every year, we will do a surgery for the kid. So you can say it's a birthday surgery. Every time, once a year, we need to do it. The limb can be expanded depending on the implant. So maximally, it can be 7 to 8 centimeters. That is possible. So again, we are using the technology here. We're superimposing the implant over the implant. The scanogram is superimposed, and a small nick or incision is given. And you turn few threads. So 1 millimeter, one turn is 1 millimeter. So this is the in between growing part we can see here. You turn the threads here, this part grows. So it based on a warm gear mechanism, this part grows here. So you can place the screw medially or laterally as per your surgeon's convenience and his planning, and the expansion is achieved for these patients. So this is the implant, this part grows. We put the screwdriver here and this part is growing. We can appreciate here, these are few threads and this part is going down. So very useful technology for kids and growing childs. So next we go to again era of amputations and what other things we are performing for all patients. So few patients you can't do limb salvage surgery. So in these cases amputation is required. So we go to again a newer technology. In this case it is tumor involving the metacarpal, means fifth finger. This bone is involved by the tumor. In this case, the treatment options, we can remove the bone, we can put the leg bone, fibula, or a metatarsal can be placed, or allograft or autograft can be placed. In this case, we had put a 3D printed metacarpal, again patient specific. You mirror one hand images to another, do all CT scan planning, and this is the implant design what we got our patent for this design. So firstly, we designed a solid implant, multiple holes were designed, then a lattice structure means honeycomb-like pattern was developed. Multiple holes were made to attach the implant to another part of the bone. And this is the final implant. We can appreciate here there are multiple holes in the implant. So the weight is decreased, and this is 3D printed and made up of titanium material. So very compatible with the body. And this is the final images how it looks. So few of our cases have we have done, and patient is having excellent functional outcome. So again, this is use of total new technology, printing the bone according to size of the patient and replacing any part of the body with customized implant if it's not available from the shelf. This is the final outcome. Small complication here, the joint gets dislocated in the area near the metacarpophalangeal joint. So that part we are trying to reduce this complication. So we always fight back again in cancer surgery. So a good example is Shrenik by here. So case of hip disarticulation. So patient where limb salvage is not possible, you cut the limb from hip joint or disarticulation. The boy is wearing this prosthesis and he's back to his school and all his activities of daily living. Again, he's independently donning and doffing his prosthesis. There will limb lurch, but he is independent ambulator. So ultimately going back to the society and contributing to his education and other activities. So that's the purpose of all our surgeries. The patient should go back to all his activities of daily living and best possible function can be given to these patients. This is one of our another patient where again this is customized prosthesis, very lightweight, and we are trying to develop our own myoelectric hand, means a hand which is electrical. So just we'll show a video of that also. So this is again one complex surgery, rotation plasty, means you cut the bone from here, here, your knee joint goes into the upper part of hip joint, and your ankle joint works like a new knee joint.
Rotation plastic.
Just I'll play the video.
Rotation.
So your tumor is removed, artery, vein, and nerve is saved. This is small simple animation. Rotate the leg by 180 degrees. So your ankle joint is at same level like the knee, and the ankle is rotated by 180 degrees. The patient will wear a prosthesis. Cosmetically not that great, but functionally it's excellent procedure for kids. They get very well adapted, and this is one of our patient where we have removed the tumor. rotate the leg by 180 degrees. So you are giving a new knee joint. So above knee amputation is converted into below knee amputation. So he's wearing back his trousers, and very difficult to appreciate what surgery was done for him. Again, independent ambulator, going back to his school activity of daily living, an excellent functional outcome. Cosmetically, not that great. So we are trying to develop our own modifications to make it a bit cosmetic, and it is a bit tough to counsel the patient and relatives about this surgery. Rotation plastic surgery is a modified amputation. Lastly, a myoelectric hand, what we have titled it as A hand or Ahmedabad hand. So the person's limb is cut, and we need to give him some prosthesis. So one of a small video. Sorry. Yes. So the limb is cut from this part, and this is a training video. So the person thinks from his brain that she wants to flex his fingers, open her fingers. So the signal goes from brain to the muscle, from muscle to skin, and from skin there are a few sensors. So that will pick the. This is one of our case where amputation is done, and these are the sensors. So person thinks from his brain, the sensor goes to muscle, skin, and the patient is able to close his fingers and open the fingers. Rest can be movement done. So this is the patient is able to grasp the glass. So the modifications we are trying to do is it will sense what object it is. Temperature sense can be added and pressure sense can be added. That work is going on, and it will be available for our Indian patients at very affordable and economic cost, what we think. Again, prototype of our hand, which works on electrical stimulus. So weighting capacity can be 3 to 5 kg. That we will try to improve. Technology means beats the human hand. What we are trying to say. This is a sensor I am touching. Fingers are opening and closing. You can appreciate it. Fingers are closing and opening. It's based on the sensors. It's based on the muscle sensor. And weight capacity is 3 to 5 kg currently. That we will try to improve for our patients. So it's always a team effort. You require good medical oncologist, good surgical oncologist friend who can take care of your metastectomies and other stuff. You require good plastic surgeons, good social workers. This is a team of can kids who are very much supporting us. This is our good friend Dr. Vikas Wariko. He is GI oncosurgeon. Dr. Nanlal is there, who is a fellow with us. Dr. Dhruv is there. So you always require a good team, good nursing care to have good outcomes to all your patients. And that's why we are able to give good function and good oncological outcomes to our patients. So we are having a 2 years training program in orthopedic oncology. This was our old building, so we have evolved in last 50+ years to this excellent setup, which is one of the biggest cancer hospitals across the globe. So this is my email ID. So if any queries, just you can email us or ask your questions. Thank you very much, Shrenik sir, for giving the opportunity to me to be part of this program.
I know that you were quite occupied on last Friday till midnight, but for us, especially for me, especially for Jyotaji and everybody at ICS Delhi, it was a really fabulous, fascinating, worth waiting for your talk by 1 week. And
Thank you very much.
trust me, trust me. I mean, the I have seen your entire presentation. It is beyond mesmerizing, and the best part is you are empowering the Indian youth, to remain active throughout their life, and everything, whatever you have explained about 3D and implant and everything. Trust me, I have never, to me, in my mind, I feel like a miracle. It's miracle. And what I have noticed, one more thing, that, you know, yeah, it is always said, by Modi sahab, कि सबका साथ सबका विकास. So in aligning with what you have said, nowadays people did not have to go to US, UK, or Australia for such complex surgery, and this can be pretty well done at GCRI. And before you join, I mentioned to just now Govindji that JCRI is one of the best hospital providing affordable cancer treatment across, not only across Gujarat but throughout India. So we are deeply grateful for everything you shared with us. And sir, I have to request, is there any, normally how long it takes to perform the surgery? Any
Yes, sir.
surgery.
So the surgical time, so we can say for tumor removal is around 2 hours, 2 to 3 hours, and then the reconstruction part is again it takes 1 to 2 hours. So average time we can say for a distal femur or a thigh or shoulder tumor, it takes 3 to 4 hours, sir, to perform the surgery.
Great. Can I request? Is there any possibility that you can arrange for us a live show, live session? The live surgery you are performing, and we don't mind. But I don't know about others, but I don't mind spending
The
3, 4,
duration
5
will
hours.
be bit. So we record all the surgeries with GoPro. I am having a camera, action camera. So I record all my
Okay.
surgeries with action camera. So that can be shown, but it is quite long surgery. So 10-15 minutes crux I can make it, because I regularly make
Chale,
videos. So
uh,
so that I like to
chalega,
make
chala.
videos. So 10-15 videos
Yeah.
I can video I can be made. That can be made.
Fantastic. That would be great. At least we want to do, cover up the important segment of the
Yeah.
surgery. Not everything, but
So we'll cover everything,
we.
but in a just fast forward way. Because 3-4 hours, no one will like to watch. It is not
I
a
know,
Pushpa
I
movie,
know,
sir. No one will like to
I
watch it.
know. अगर सर हम 3, 4 घंटे की सर्जरी देखेंगे ना, तो आप लोग ही सर्जन बन जाएंगे.
वो तो सर हम तैयार है. The
Thank you.
advantage is working at a government hospital, madam. We have one of the highest numbers. Government is supporting, and multiple NGOs are supporting. So
Yes.
the work what we are doing is comparable or better than any cancer center across the globe. So that we are for sure, because 3D printing, AR, VR, very less centers across the globe are we are using it. And for last 10 years, we are using this technology.
Mhm.
That's the advantage of working at DCRI.
Abhishek ji, I had a comment and then one or two questions.
Yes, madam.
First, that Can Kids grew out of ICS Delhi.
Yes, madam. That is great. They are
It
really
was,
supporting us, madam.
Can Kids was a unit of ICS Delhi, but they grew very fast and very large. So
Yes, madam.
they decided to form their own organization.
Yes, madam.
Yeah, so we are very proud of Can Kids.
And ICS is supporting, madam. Indian Cancer Society is supporting us.
Is that right? From
They
Bombay,
are also supporting us.
Cancer Cure Fund. Yes,
Yeah, madam.
I'm on that.
So we fill the form and send it to Mumbai. Most probably it goes to Mumbai, madam. Most probably.
That's right. That's
Yes. So
so.
regularly we are taking the help of ICS. So there are two NGOs who are supporting significantly. One is ICS and second is Can Kids.
Wonderful. That's great. That's
Because
great.
you require, madam, significant amounts.
Yeah.
Government is significantly helping, but something the patient is not from Gujarat, or we get patients pan India, any part of the country. Government schemes may be bit limiting factor for them. So the NGO support is genuinely required.
Yes, I understand that because I work on the governing board, the advisory board of Cancer Cure Fund.
Great, madam. We'll take you lots of help now, madam.
Okay. No, I was intrigued by the fact of the multiple holes that you make in the prosthesis.
Yes, madam. So you need to fix the chest wall, madam. Ultimately,
Yeah.
chest wall को fix करना पड़ेगा. नहीं तो ऊपर उठ जाएगा वो. क्योंकि वहाँ कोई muscles नहीं रहेंगे, तो we need to fix it, anchor it. So
Yes.
that's why we made multiple holes there.
So then you make multiple holes in the chest wall also?
Chest wall, madam, we just muscles के साथ stitch कर देंगे.
Acha. Okay.
Chest
Okay. Yeah. It was really fascinating, as Shrenik
Thank you.
said. And I think it was worth waiting that 1 week for you.
Thank you very much, madam. Thanks.
So all the best to you, at least from me.
Thank you very much.
If there are any more questions. Ritika,
Shrenik sir, any questions?
are there any questions? I didn't see participants. Maybe they are on YouTube.
Yeah, ma'am.
No, ma'am. Actually, nobody wants to questions.
Yeah, it was a good presentation. We got a
Thank you very much.
yeah, and I really think, Abhishek, that we keep talking about America and the UK and wherever, but ultimately they will be coming to you and to.
That's the purpose, madam. We want to make a center of excellence where people can come and train here.
That's
Ultimate aim is that
correct.
overseas people should come here. So currently, the Asian surgeons are coming to our center. So ultimately, we want to have an exchange program.
Yeah.
With, we have talked with one of a few of our colleagues in UK, British Indian Orthopedic Society.
Yeah.
In the future, they may agree that we can have some collaborative program. So our student goes there for a few weeks. Their student comes here and see the bone tumor surgeries.
Yeah.
And other surgeries at our center.
Well, I look forward to that day.
Yeah, man. So I'll get your email ID and contact details from Shrenik sir.
Yes.
We'll be definitely in touch with you, man.
Surely, surely. And
Yeah. Chantaji, once you are done, I would like to speak to sir as well. So please continue.
who?
I mean, if you have any further questions
No.
or
Oh, no, I finished. Thank you.
Thank you.
yeah, sir, I have two requests now.
Yes, sir.
Number one, I would like to have a one-to-one meeting with you and
Definitely.
some of your key decision maker in the next week, if it is possible for an hour
Definitely.
or two, because I love that idea of bringing the patients from other countries to JCRI. And since I have spent a lot of time in branding, marketing globally, I believe I will be able to make things easier. And I would rather love to coordinate making things happen. So kindly, have a word with your team members, decision makers, etc. And let's meet and let's try to figure out
Definitely.
something for the best for our country and for the people in India and outside India.
Definitely.
I am truly impressed with everything you are doing. Say I met you some few years back, we had a coffee, but then
Yes,
now I guess we need to have one more coffee, but that
Definitely, sir.
coffee will last for 2 hours.
Definitely, sir. It was really great opportunity to speak with you and madam. So thank you very much.
Thank you.
Thank you, madam. Thanks.
Thank you so
Thanks.
much. Take care. Bye.
Thanks. Bye.